How do you know the difference between an irritated or swollen sciatic nerve and a sciatic nerve that is really adhesed? This is an addendum to the 5-day Find, Feel, and Fix the Worst Spot for Chronic Sciatica challenge. Some people say that they want to advance their ability to fix this, so we thought we'd create a video. Your ability to treat an adhesed sciatic nerve will get people sustained permanent pain relief. If you treat an irritated or swollen sciatic nerve, it's going to hurt a lot during the treatment, and it's probably going to hurt a lot the next night, the next day, and probably for a few days until that nerve recovers and just comes back down to the baseline. So this is an important distinction to make. Assuming that you can find the sciatic nerve because you've taken the challenge. So it's right here, it's about as thick as my pinky on her, and it goes up until it dives under the piriformis, about right there, and then it goes down until it dives underneath the hamstring tendons going that way here. This is all the sciatic nerve. First, if you're pushing on the sciatic nerve and then somebody is jumpy and you can tell that the tissue is just irritated, it'll feel like it's popping you off it really quickly. That's a good sign that it's irritated or swollen. Also, a swollen nerve will be thicker than it typically is otherwise. If you've felt 10 sciatic nerves in the past week or two, and then all of a sudden this one feels thicker and it also feels squishier, there's probably liquid in the sciatic nerve, then it's actually swollen. However, if you're getting here in the sciatic nerve and then you get into the spot where you would treat adhesion, which is typically, if this is the sciatic nerve, I'm getting on the lateral side of the sciatic nerve and I'm trying to get underneath it so I can peel the nerve off of the external rotators. So if I'm getting in here and I'm sinking into the tissue, taking depth at this angle, because you don't want to create any skin tension, that's the principle. And then when you go to take a tension set deep underneath the nerve, you're feeling a lot of pushback. So if the nerve's here, I'm taking my tension that way, and I'm feeling a lot of pushback, that's a good sign that there is severe adhesion, or at least moderate adhesion in that spot. If the pushback is large and the nerve isn't necessarily irritated or swollen. And this will only come from getting a lot of repetitions and feeling a lot of different nerves. So I recommend that you practice as much as possible. You may not be able to feel it in the beginning, but if you just are present in your mind as you're doing person after person, feeling sciatic nerves and comparing one person to another person, comparing one spot to another spot, you're going to be able to fill in this database in your head of what it's like to feel adhesed nerves, healthy nerves, and then swollen or irritated nerves. I hope this distinction is helpful, and if you try it, let me know how it goes in the comments. If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.